Hello guys, welcome to my channel Document School. Today's topic is anterior axio-appendicular muscles, the continuation of the previous video that we made on anterior axio-appendicular muscles. In that we discussed about pectoralis major and pectoralis minor, but the continuation of the video is here, and it speaks about subclavius and serratus anterior muscle, which we have left in the last video. So without wasting much time, let's get started. Subclavius muscle, it's a small round muscle present just below the clavicle, and it lies horizontally when the arm is in the anatomical position. And you know what's the anatomical position, you might be knowing about it. And it lies horizontally just beneath the clavicle, and its attachments are the origin is from the sternoclavicular head, the first rib, and the first rib and the costal cartilages of the first rib, and the insertion is in the inferior surface of the clavicle, at the middle third of the clavicle. Like if you divide the clavicle into three equal parts, sorry, I divide the clavicle into three equal parts. The insertion will be in the middle part of it. Okay, and as we said, it is present beneath the clavicle and above the subclavian vessels. What is this subclavian vessels? Subclavian vessels are the vessels, the major thing is the cords of the brachial plexus, which is present just below the clavicle, just below the subclavius muscle. Why is it present below the subclavius? It is to provide the protection. To the vessels on the brachial plexus and the cords and the veins and all other stuff which is present beneath it. It provides protection from the clavicle, from the bone. The muscle provides protection from the bone. Like the clavicle is prone to get fracture, and when it gets fractured, the subclavian muscle will be just present beneath it to prevent much tension between the tension between the muscle, between the bone and the vessels which is present beneath it. That's an important clinical aspect of it. And the next one is that it anchors and depresses clavicle. Why? Like this is the most important one. The major functions of the subclavian muscle is this one and this one. Sorry, having a fever. It anchors and depresses clavicle, means it holds it, it pulls it down, and it keeps it in position without letting it to move way apart from its original position. It prevents the dislocation. It prevents the dislocation of the clavicle at the sternoclavicular joint. Dislocation of the clavicle at the sternoclavicular joint. The easy example for this is imagine like playing a tug of war, game tug of war, in which you pull the rope towards yourself by putting the force at the sternoclavicular joint outwards. It is much more prone to get dislocated from that joint. So the subclavian muscle pulls it back because it is attached. Its origin is from the sternoclavicular head. It pulls it back and keeps it in a position, or keeps it balanced forces. It helps in maintaining balance. It balances the forces. It balances forces acting on it and prevents its dislocation. The innervation or the nerve which is supplying the muscle is subclavian nerve or nerve to subclavius muscle. It is also called as nerve to subclavius muscle, and helps in the action of the muscle. So we'll see it in the picture right now. So let's move on to it. So as we said in the lecture before, so you can see it in the picture over here. Its origin is in the sternoclavicular joint. At the sternoclavicular joint, between the origin is from the first rib, and the junction of the first rib and the costal cartilage of it, and its insertion is at the middle third of the clavicle. When you divide the clavicle in three equal parts, the middle part, at the inferior surface of the middle part of the clavicle, it's get inserted, and as you can see, it is almost horizontal. it's almost horizontal. And if you know that in the anatomical position, it's horizontal in the anatomical position. In the anatomical position, the humerus, the lesser tubercle of the humerus points forward, and with respect, lesser tubercle points forward, and with respect to that, we can see it's almost horizontally, the lying just beneath the clavicle, and from below of the subclavius muscle, the cords of the brachial plexus which pass to the upper limb, cords and other vessels like arteries, veins, and all that which pass through it, and sternoclavicular joint, the insertion at the end, and the innervation by the subclavian nerve, and the main action is it anchors and depresses the clavicle. So that's it. Let's move on to serratus anterior. After studying about the subclavius muscle, let's move on to serratus anterior muscle, which is the next muscle in the anterior axio-appendicular muscles. Okay, it has, as everybody knows, it is present on the lateral side of the thorax, and it has sawtoothed appearance of its fleshy slips or digitations. Sawtooth, like if you have seen the saw, the edges of the saw are like triangles, sharp triangular shaped edges, which helps in the cutting of the stuff around stuff. Sawtoothed appearance because it's seen as a sawtooth, like, and it overlies the thorax on the lateral part of it, as you have said. Now it is one of the most powerful muscle in the pectoral girdle. Now this is something to consider. It is one of the most powerful. It helps to keep the scapula towards it with such, and it also helps in lifting up of the body when you are doing pull-ups. Usually it is one of the most powerful muscle in the pectoral girdle, and it is a strong protractor of the scapula and is used when punching, hence called as boxer's muscle. Strong protractor of the scapula. What do you mean by this strong protractor of scapula? It's simple. When you take your arm out, like when you push your arm out, it protracts the scapula. The scapula comes front. When the scapula, if it is like this, it gets around and becomes like this due to the lower or inferior fibers of, when the inferior fibers of the scapula, it gets attached to the inferior angle of the scapula, and it pulls the scapula towards the thoracic wall, making it to rotate around it, and lifting up the glenoidal cavity, and allowing the arm to move forward. Now let's see some more points about it. The serratus anterior muscle holds the scapula against the thoracic wall. This is most important point. Against the thoracic wall, making other muscles on the back to use it. It means scapula as a fixed bone, which scapula is not. Scapula is not a fixed bone, but due to the presence of the serratus anterior muscle, it makes it so. It makes the scapula to stick to the thoracic wall such a way that the scapula behaves as a fixed bone, but it isn't. Making other muscles like there are many other muscles above it, which we'll see in the future videos, will help to move on the scapula. It helps in the push-ups. Okay, this is what we were talking, push-ups or pull-ups. When you press the surface or press the floor in which you are doing push-ups, the scapula is held by the serratus anterior towards the thoracic wall, making it to be there as it is, which helps the muscles to actually use it as a fixed bone and help you doing the push-ups. Now let us speak about the innervations. The innervations to this muscle is a long thoracic nerve, and that's the clinical part of it. We'll see about the clinical aspect of clinical anatomy of the serratus anterior muscle. Now in the clinical anatomy, the long thoracic nerve which supplies this muscle, long thoracic nerve which supplies this muscle, is more prone to get damaged during surgeries or injuries, because when the arm is abducted position, it is more prone to get damage. Surgeries, in which kind of surgeries it is more prone to get damage? In the cancer, removal of the cancer or removal of the lymph cancers, especially the pectoral lymph, and in the mastectomy. Mastectomy is the removal of the breast cancer, which is more present in females. It helps in the when surgeon actually gets into removal of this by mistake, not intentionally, by mistakenly it gets cut on the long thoracic nerve unknowingly, making it making it to not function, making the serratus anterior muscle to not functioning. What causes afterwards is most dangerous. Like, the serratus anterior muscle won't be able to respond, or won't be able to function properly as it used to do before, when the long thoracic nerve was well present there. The thing that happens is called winging scapula. Winging scapula. Winging scapula, and I'll put a picture of it during the explanation of the serratus anterior muscle when we explain it through the picture. I'll put a picture of the winging scapula, patient suffering from this kind of disorder. What is winging scapula is that after the long thoracic nerve is cut out, by mistakenly cut, the serratus anterior won't be able to function normally, and we spoke of this. It is pushed against the thoracic wall initially. Now this function is lost. I mean, you won't be able to hold the scapula against the thoracic wall, making it to be as a loose bone as it originally is. And you can test it by making the patient who is suffering from this to push against the wall. By pushing against the wall, you can actually find it out. Pushing against the wall, and the person will and the scapula will come out as a wing. That is why it is called winging scapula. It comes out as a wing. You can compare it between the other scapula, which is normal, and the scapula which is actually get affected. You can easily make out that the muscle is, or the nerve is affected, have got injured. Okay, now we'll see a summary of this. Let's see summary of both of the muscles, subclavius muscle. Okay, the summary of the subclavius muscle is that the origin of the subclavius muscle is at the junction of the first rib and its costal cartilage, and the distal attachment, or the insertion, is the inferior surface of the middle third of the clavicle. Inferior surface of the middle third of the clavicle, and innervations, as we have spoken here, subclavian nerve innervates this muscle, and the major action, or the main function of this muscle is anchors and depresses clavicle. Anchors and depresses clavicle, the main function of the subclavius muscle. Now let's speak about the summary of this serratus anterior muscle. The origin, or the proximal attachment of the serratus anterior muscle, is external surfaces of lateral parts of 1st to 8th ribs. External surfaces of lateral parts of 1st to 8th ribs is the origin of this muscle, and the insertion is at the anterior surface of the medial border of the scapula. That is how the whole medial border of the scapula is attached by the serratus anterior, starting from the root of the spine till the inferior angle. It is attached. It is in the serratus anterior muscle gets inserted at that position, and that is how it maintains the scapula against, or that is how it helps in maintaining the scapula against the thoracic wall and making it as a fixed bone, which it isn't. And the nerve which innervates this is the long thoracic nerve, which we discussed. It is it's the clinical aspect of the serratus anterior muscle, and the main action of the serratus anterior muscle is that it protracts the scapula and holds it against the thoracic wall and rotates the scapula. Rotation, as we have discussed, the inferior fibers of the serratus anterior muscle, they pull, or they get contracted, making the inferior angle to come above to the lateral aspect towards the glenoidal cavity, lifting the glenoidal cavity. That's how it makes it to rotate the scapula. And protraction is also the result of after rotating the scapula. And of holding is the holding, we have seen it in the anomaly or the lack of functioning of the thoracic nerve due to some factors which we have discussed before leads to this disorder called as winging scapula, which we will show in the picture as we explain through it. So here we are discussing about the serratus anterior muscle, and as we have discussed in the theory before, that lecture before, that it has sawtooth appearances, which you can see over here, the sawtooth appearances of the muscle. After you see it, it's more, you think it has a sharp edge, triangular shaped edges, which is much more similar to the saw, the tooth of the saw. And the origin, as you can see, it's from the first rib to the 8th rib, and the lateral part of the thorax is also there. And it goes back to the scapula and medial border of the scapula and gets attached from the root of the spine till the inferior angle, as you can see over here in the side diagram, which the side of this at the side there's the scapula. You can see the red color marked over here in the medial border of the scapula. It's mainly the left hand of the person, and it's get inserted into the medial border of the scapula from the lateral part of the thorax till the medial border of the scapula. It is a strong protractor, and here is what, see, the fibers when they contract, and contraction is mainly due to the contraction decreases the length of the muscle fiber, and relaxation increases the length of the muscle fiber. And during when it contracts, the muscle fibers of the serratus anterior muscle, when it contracts, the scapula is held against the thoracic wall, and there is no much more stronger muscle at the lateral border to pull it here. It gets attached to the thoracic wall as a fixed bone, and due to which it is very helpful. The serratus anterior is very helpful to make it be there against the thoracic wall, and it helps in the protraction, and it's also called as the boxer's muscle, which you have discussed in the lecture or the theory before it. So that's it. We'll see the winged scapula, the clinical part of the serratus anterior, the picture of the winged person suffering from the winged scapula. So we are seeing a picture of the person who is suffering from winging scapula, the disorder winging scapula. And as you can see, you can make it out clearly when you see it. The scapula over here is the long thoracic nerve of the serratus anterior, which is present this side of the right side of the person, is might be cut or injured. Anything might happen which has led to the serratus anterior muscle not to function properly, causing the winging of the scapula. And as you can see in the left side of it, over here, the scapula is functioning, the serratus anterior is functioning properly, which we can see when there is no winging of the scapula on the left side of the person, but there is a winging of the scapula on the right side of it. So this is how it looks, and that guy is mainly pushing to the wall in front of him. And when you push, the serratus anterior is supposed to, if it is normal, the serratus anterior is supposed to keep the scapula fixed against the thoracic wall. But if it is not functioning properly, it won't be able to pull it against the thoracic wall, and the scapula will be hanging or winging outwards, getting outward. So that's it regarding the serratus anterior over here. This is all about that's it for the video. We'll see you guys in the next video. Bye. Subscribe to my channel, like, share and comment as well, and click the bell icon to receive the new videos.